My name's Caroline. I'm a nurse with the Calgary Stroke Program, and I've been there for 12 years. Prior to that was in Emerge, so I kind of know both areas a little bit. I'm going to talk to you today about the clot box. I want to say, like John said, not my fault. I did not name it. If you're coming up with some kind of box, name it something other than clot box. When you're in the elevator, everyone's wondering what exactly is in that box. It's quite embarrassing. So, anyway, I won't make you cry, Noreen, by the way. So, lots of advantages to a clot box. I'm personally one who likes to stay calm. I don't like to fuss around. I don't like to get worked up. And so, the main advantage to the clot box is that everything you need is right in one place. We don't have to run around. There's no guesswork. There's nobody panicking, especially when Michael is breathing down your neck. It's all in one spot, so it's easily accessible to the stroke team. It's an emergency. We can just grab it and go to wherever we need to be. And I understand that in the Foothills, our hospital is a little bit different logistically than some of yours. You're from smaller centers, and it's easier to get around. Your CT scanner obviously is closer to the emergency department. But we need to be able to grab something and go. It allows us to administer TPA very quickly from wherever we are in the hospital, and that may be CT, it may be angio, it may be, on the way to the unit. And we do have limited drugs available with us also, again, because we can't always get back to emergency. So this is what our clot box looks like. It's a lovely green box, looks like a fishing tackle box. I think it probably was in its former life. When we open it, this is what we see. Now that looks like a lot of stuff in there, so I'll break it down for you. Again, I understand that logistically our hospital is bigger, so we're away from emergency. So we have what we need in our box. You may want to, put different things in it depending on your needs, right? So right on top of the box, as we open up the box, the first thing we're going to see is the Tpa Infusion Sheets. There's two of them because one may get lost. They're always wrapped in plastic because they may get wet, right, with the TPA. So that's what's on the box first. We also have a couple of boxes of TPA. We get very frequently 2 patients in at the same time. So we have 2 boxes, but you, again, may only need 1 box. And we have our syringes. So everything on that top level there is designed just for the TPA administration, right? You have your drug, your syringes, and your chart, your dosage chart. So on the second level then, we have all our IV supplies. Again, you can see the blunt needles there to give the bolus. Other than that, it's all IV supplies, right? Part of our STAT protocol is that when they come into Emerge, they need 2 IVs, but that's not always the case. Sometimes we get over there and we've blown an IV or we need a second line. So everything we need to start an IV is right there in the clot box as well. And then in the bottom, we have our vented IV tubing and our flush syringes for when the TPA is done. And on the other side, we have a point of care testing machine just to do rapid INRs. I understand most of you don't have that, but we have that in there also. We don't have anything in there to take blood. We don't draw any labs unless they are on blood thinners, and then we do that in emergency before we ever leave the department. So if they're on Coumadin and we want a rapid INR, we can just bring out this machine and test it quickly. It's like a glucometer, just a little drop of blood, and then we know their INR very quickly. Okay. So drugs. So when we're thinking about drugs, we just want to know what's going to delay the scan potentially and what's going to delay the administration of TPA. So when we think about that, when you put a person in the scanner, if they're seizing, that's going to obviously delay the scan. If they're vomiting, that'll delay the scan. We don't give TPA if they're hypertensive. So those are the kinds of things we're looking for in our drug box. Again, we are a long way away from emergency when we're in the scanner, and so running back and forth to Emerge is not ideal for us. We prefer to have it with us. So again, hypertension, vomiting, seizures, and of course allergic reactions. If there is something that we need that is not in this box, we should be probably back in emerge, or we should be calling a code. So we've got metoprolol, Benadryl, labetalol, Midaz, Maxran, hydralazine, ondansetron, and Gravol. And that's constantly evolving, right? As people want different drugs, we change that up. So that's what we currently have in there. But again, like I say, for us to run back to emerge isn't feasible most times. So this is the contents of our clot box. That's it in a nutshell. That's very fast. But we also have this list up on the QuiCR website if you want to access it. Again, it's just a suggestion of what we have in our box. That's not necessarily what you're going to need in yours. You'll have to gear it towards your facility, obviously. And that's it. I guess the message really is keep it simple, right? So the fewer things, the better. Okay.